A very warm welcome to everybody, and thank you for joining Dr. Christina Hoffmann, Dr. Samya Pinheiro, and myself, Brendan O'Flaherty, for today's webinar. So today's webinar, we will explore new ways to understand climate risk and reduce health impacts for people with chronic diseases, whereas we will also be showing a case study with COPD patients and potential protection strategies. Today is the fourth of the series of 6 webinars that we have in total, giving our Oasis Hub members new and established a unique opportunity to learn, interact, and ask questions from a truly global panel of industry experts. So to all of them, we thank them very much. So before I formally introduce today's panel, I think it's important that I mention Horizon 2020, whose funding allows Oasis Hub to create this wonderful and truly insightful webinar series for all of our community. So thank you so much to Horizon 2020. We're very grateful. So today's panel is Dr. Christina Hoffmann, who is the project manager and head of research at the Department of Outpatient Pneumology at the Charité University Hospital in Berlin. So Dr. Christina, who also studied biochemistry at the Freie University in Berlin, where she finished her PhD studies in medical science. And since 2017, Dr. Hoffmann has analyzed the impact of climate change on patients with chronic respiratory diseases. So we're very lucky and fortunate to have Dr. Christina here today with us. Our second panel member is Dr. Samya de Lara Pinheiro, who is a meteorologist and business development manager at ARIA Technologies in Brazil. I believe that's Rio de Janeiro, where she's based. Dr. Samya is a meteorologist specialist in air pollution and human health, collecting past collaborations with several research groups. Dr. Samya has been involved in major air quality and climate change projects developed by ARIA in Latin America, and her work includes technical and scientific development of modules and solutions for climatic and environmental impact assessment. So thank you both. You're very, very welcome here today. So as I hand over control to Christina and Samya, I'd like to encourage the audience to ask any questions via the Q&A area that's available on the platform, and the panel will be happy to answer at the end of their presentation.
And therefore, I'm seeing patients with chronic lung diseases, so I've got an inherent interest in their health. And the university hospital I'm working in is located in the German capital city of Berlin. And recently there has been a discussion about traffic-related air pollution here in Berlin, and if we should maybe limit or ban traffic from certain cities. So this is why we've got an interest in air pollution. And of course, air pollution concerns every one of us. With every breath we take, we draw in the air pollutants, and I guess nobody of us likes to inhale dirty air. But air pollution is especially harmful to people who are already suffering from a chronic respiratory disease. If they inhale the air pollutants, then these pollutants like particulate matter, nitrogen oxides, ozone can irritate their lungs, cause inflammation or worsens the inflammation already present, and reduce the self-cleaning capacity of the body and even lower our defense mechanisms. Next to air pollution, also climate change and heat and cold are becoming a topic in Germany. We've been seeing more and longer lasting heat waves here in Berlin, and even suffered from droughts in the past 2 years, affecting our agriculture. And again, heat is affecting the vulnerable people most. It worsens the health status and can even lead to death. there has been some nice studies published by Professor Gasparini, who's working in London, and he's looking at the mortality of people related to heat and cold. And as you can see in the graph from his projections, depending on how bad our climate is going to change, excess mortality due to heat will become a big problem, a worse problem than it is even today. So what we need are mitigation and adaptation strategies to counter this. So this is a bit of our motivation for the project. And as we're working in the Horizon 2020 insurance project together with people from risk management, the usual approach when facing such risk at climate change and air pollution is first to analyze the situation, understand what's going on, and then you can monitor it and finally manage it. And this is why we started our study. We looked at Berlin and Potsdam, two close by cities in Germany. Potsdam has the least sealed surface landscape in Germany of all cities. So it's very green with a lot of parks, and Berlin is a big metropolitan city. So we have two cities to compare with similar climate but different structure of land use. And the people we are looking at are our patients with chronic obstructive pulmonary disease, because they are known to be vulnerable to heat and air pollution. And Samya is now taking over to tell you how we started our analysis with data collection.
Thank you, Christina. So definitely we started all this assessment, collecting some data to try to definitely evaluate the environmental conditions over the two areas of interest. So the first collection of data that we gathered is related with the land use, population density, and the road network. All this geographical data is important to describe basically how the emissions are being released in the local atmosphere. So that's why it's so important to understand where are the industrial areas, how the road network is distributed over the region. So here in this figure, it is illustrated the traffic flow density in the Berlin area and also Potsdam. And you can clearly see that's a higher density in the inner Berlin downtown. It's quite different from the Potsdam area. And this is really important to address and really try to detect how the air pollution would be different on those two areas. And also, even in Berlin, we have a high heterogeneity of the geographical data. So this is important also to have in high resolution. That's why we are coming here with a specific methodology to describe all this data in a resolution of 500 meters. The second collection of data is regarding meteorological data. As Christina already mentioned, it's important to describe mainly the exposure to heat. Once due to the climate change, it's likely that we might face higher exposure to heat extreme events. But we, of course, need to address the impact of all different meteorological variables. So that's why we're not coming only with the temperature, but also describing the wind speed profile over the region, solar irradiation, relative humidity, air pressure, and water vapor pressure. And this map is presenting to you the estimated air temperature for one specific day. And it's based on remote sensing data and also the distribution of the land use over the Berlin area. As you can see here, we are in the very high resolution. For this instance, it's about 30 meters resolution. The urban heat island, it's quite represented in a very downtown Berlin meted neighborhood, in neighborhoods around the area. And you can see here in different neighborhoods in Berlin, definitely the temperature is quite lower than in the Berlin downtown. The third collection is regarding air pollution data, and we are focused on free pollutants. Those are the most important to address the impact on respiratory disease and, for instance, for COPD patients. So we are capturing information regarding nitrogen oxides, particulate matter smaller than 2.5, and ozone. For each of those pollutants, we have a different type of measuring network over the area. So that's why you have the different number of stations here. So for instance, for nitrogen oxides, we have 24 measuring stations over the period of study. That is between 2012 and 2016. For particulate matter, just 11 stations, and for ozone, 12 stations. This definitely can be considered a high density network over the area. And unfortunately, it's not the case for all the huge urban areas all around the world. But definitely it's a great setup to address the environmental conditions over the area. Based on those collections, we came up with an environmental database, as I mentioned, in high resolution. This is quite important to address. Of course, we can use different methodologies to define the exposure in one city. But the idea here is definitely to describe the whole city and in high resolution. So here is represented the fields for different pollutants. This is daily mean concentration by zip code. So that's why you have all these tiny segments inside the maps. And this is not only an idea, oh, let's use the zip code is the lowest resolution. In fact, once we are also crossing this data with the geographical data that we already mentioned, usually the smallest unit that we have this data is by zip code. So that's why it's so important to keep the zip code as our unit basis. And in the end, we also came up with an aggregation by district. So here, for the maximum and minimal temperature, for example, based on those maps in very high resolution that I'm already presenting to you, we also aggregated by district. This, of course, is trying to capture the association ones. Depending on the district, usually all the vulnerability characteristics are quite similar. So it makes sense also to aggregate by district. And for all these environmental database preparation, we worked together with DTU that definitely came up with this quite interesting methodology to represent the temperature based on remote sense data and land use information. And I will give back the control to Professor Christina to talk about a little bit about the hospital admission data.
Thank you, Samya. We had to take care here in Berlin to gather some data on what worsens the health of patients. And this time we did not decide to look at mortality of people, but we wanted to look at if the disease worsens, at morbidity, and chose as an endpoint that we want to look at hospital admissions of COPD patients. First, we started to collect data of hospital admissions from our own Charité hospital database, and we run hospitals in 4 locations over Berlin. But to have a good coverage, we then teamed up with the German Red Cross, who provided data from their 4 hospitals, and also with the Vivantes Netzwerk für Gesundheit, a company which runs 9 hospitals in Berlin. So in the end, you can see we've got quite a good coverage of the whole Berlin area and received hospital admission data on a daily basis. Then we aggregated these data depending on where the patients live. The COPD patients we are looking at are mostly elderly people, around 70, 80, 90 years old. So commuting to work isn't really a topic for them, and we just assume for our study that they are spending most of their time in the district they are living in. So we looked at their home districts and then corrected for the number of people living in the district. And what you can see in the graph is an aggregation of the number of hospital admissions by season. And it's also sorted by district, and the district in the center of Berlin, which is called Berlin-Mitte, that's in deep purple, and it's the district with the most hospital admissions. So it was interesting to see if this would also be a district with the highest air pollution or with the heat islands, as you've already seen in the database. We then combined our admissions with the environmental data to see which is the relationship between exposure to temperature, to meteorological data and air pollution, and see if this increases the risk ratio of patients to suffer a worsening of their disease and having to go to the hospital. And this is our result for Berlin Center. We came up with the results that indeed nitrogen oxides and ozone, and also the minimum and maximum daily temperature, do increase the risk of the COPD patients for hospital admission. And this happens on the same day of exposure. As you can see in the graphs, we also looked at the day of exposure, that's day 0, and the days afterwards, up to 7 days later. And the risk is highest when the exposure really happens. The risk ratio for NOx is 1.027 for each increase of 10 micrograms per cubic meter in NOx concentrations. So if this increases more and more, also the risk rises up. And 1 day afterwards, you can see that there's a drop in risk. It even drops below 1, which would be the normal risk, which without any increase or decrease. And this is called a harvesting effect, meaning all the patients who are already suffering a lot and who might have to go to hospital soon are exposed to air pollution, and this causes them to go to the hospital, so that on the next day, everybody who was very vulnerable already is in the hospital. So we've got fewer people coming to us. And also ozone does increase the risk for each increase in 10 microgram of cubic meter ozone. The risk ratio increases by 1.045. So this is really an argument maybe to have less traffic in Berlin Center. With our data, we even went a step further. So what can we do now with the damage function we found out? Samya started already to calculate which costs does this cost, which costs do appear due to this due to these changes. And what you can see in the little graph in the lower right corner is that the people living in Potsdam, that's the yellow area, they are causing less costs for the health care system, for the insurances, because they live in a healthier environment maybe. And what can you do now with our data? Well, we will provide soon our databases on the Oasis Hub. There you can see the link. If you're not already familiar with the Oasis Hub, Samya is already sending the data to them, and they will be soon available for you to use. And Samya will also tell you now about our ideas for exploitation of our results.
Thank you, Christina. So basically this specific methodology we define as one specific service. It's called the risk impact assessment for planning purpose. As you can see, it's a static study that we have to perform once, where we can detect those exposure response functions, and those are local and population specific, and they are capable also to detect all the vulnerability characteristics of the area and of the population. So the idea for this service is definitely come up with the right resolution environmental database and apply the user-specific health data. And in terms of value proposition, we are dealing with morbidity, or it can be either related to the mortality cost, and not only the current cost. Christina has shown you the calculation of the current cost based on the 2012 to 2016 analysis. But of course, we can also implement projection analysis. So considering the climate change scenarios and even adaptation strategies, we can make a projection calls. And in terms of customers for this type of assessment, we've been seeing mainly the public health authorities that definitely want to understand the burden of air quality and also the heat exposure considering the climate change, but of course the health insurance as well. And as a second service that can be potentially applied for this topic is the forecast service. The operational forecast works similar as all the weather forecasts and even the air quality forecasts does. But the idea here is mainly to implement an alert system to really manage the peaks of consultations for respiratory disease. And for instance, the idea is not only give the information regarding the air quality or even the heat exposure, but also implement some specific recommendations for the patients or even to alert the hospital team or some specific physicians or clinics. The main idea is to optimize the medical resources just really for a better anticipation of the peak frequentation for the hospital. And the main customer or channel that we are racing to commercialize this type of service is definitely the health operators, so authorities, hospitals, clinics, and even doctors. Also, there is a potential market to be explored for this service. It's the telemedicine market that I will speak briefly in this next ideas of application. So considering the two services, the first one, the risk assessment, can be applied definitely for the urban planning. So is the government definitely can apply those informations to understand how they can adapt for climate change. Also, considering the heat and air pollution action plans that are being put in place already, we can integrate mitigation and adaptation strategies. So definitely the cost projections is a great tool to define the best actions and the most feasible ones. In terms of the application of the second service, the identification of patients with increased vulnerability, it's an added value for physicians and for hospitals itself. Based on the forecast, they can identify areas or patients that can be more likely to visit the hospital emergency in the coming days. And also, even to protect those patients based on those forecasts, those patients can receive some recommendations and advice on how to react and even to protect themselves to heat exposure and air pollution as well. And in terms of future developments, considering the H2020 insurance project, as Christina already mentioned, we are also taking account the future climate over those analysis. So for now, we just represented the present conditions, and based on the future climate downscaling database, we will also make cost projections considering the climate change and even trying to detect the impact of adaptation strategies to compare those two scenarios and say, of course, you can have a cost benefit based on specific adaptation strategies. So that's for today. I would like to thank you again, Brenda, for having us, and it's our pleasure to give more information regarding the methodologies and the project as well.
Yeah, thank you both. That was such a wonderful presentation and fascinating. And of course, we do have some questions from the audience. And those who haven't asked questions, please feel free to do so. So I know that Dr. Christina, Dr. Samya, and I'm more than happy to answer. So the first question, I think it's for you, Dr. Samya, is how many cities use this risk assessment for adaptation strategies?
The risk assessment that we are proposing for H2020 insurance is, as I mentioned, capable to detect the impact of environmental risk factors on health, considering all the specificities of the city and of the district, and also the population vulnerability. So this is definitely a different approach than the used national evaluations that we can see in the past 5 years, and give a more precise idea of all the costs that are being overseen related with those environmental risk factors. The cities can understand the cost-benefits characteristics of all the adaptation measures. And for this case, I'm not mentioning which adaptation measures, but for example, the public health infrastructure allocation, it's a good example in terms of adaptation measure. For example, Charité has some rooms equipment with her radiant cooling system that can improve the patient's recovery. And maybe even Christina can make some comments about that. But the good thing is, it can be interesting to have more of those rooms across Berlin area. But of course, in terms of cost benefits, is it attractive and feasible to really have more of those rooms? So that's why this risk assessment, it's a good strategy to address the cost benefits of those specific adaptation measures.
Okay, cool. So what about the replication of this work in other regions?
So as I mentioned, all the methodologies relying that much on data. So definitely the main challenge here is regarding the data availability. And many of the underdeveloped countries don't have a monitor network so rich as Berlin and Potsdam area has. But for those cases, we can also apply different methodologies based maybe on remote sensing or even on modeling to represent the environmental conditions over the area on high resolution, of course, and then definitely represent better the risk and evaluate the specific conditions in terms of cost benefits analysis as well. So of course, the data availability is a critical aspect, but all the methodologies fully replicable on other areas.
Okay, cool, thank you. So a question for you, Dr. Christina. So that's coming from the audience. So how the health sector can use the forecast system service to prevent climate change impacts?
Oh, that's a good question, thank you. Because I'm working in a hospital, I'll start maybe with hospital first. Samya already mentioned that we've got a few special patient rooms with cooling now. And what we've seen in this summer was that we need more rooms with cooling because we had too high temperatures on our wards for the patients. Patients suffered, and we even had machines failing because of the high temperature. So we have decided to modernize our ward and to build more rooms with cooling. And a good way maybe to use the forecast system would be to see when could we do this? Because the forecast system could allow us to plan our resources. When is a good time to close down the ward? When do we not need so many beds for the patients? And when should we open the ward and not be busy with air conditioning because many patients will come to us? So this could be interesting for hospitals to plan their resources. And then for physicians, I think currently physicians aren't really looking at where patients live. If we provide more information to them, we could make them aware of a whole new dimension of vulnerability of their patients. If they see, oh, you're living close to a road with a lot of traffic, then this could be a factor for the patient's health. Maybe we can give them then better advice. And also we're planning maybe to have a little information portal available where the patients themselves can check their daily local risks, what it looks like in their vicinity. I would like to have an app maybe with positive news, not that they excuse themselves, oh, today I can't go outside, the air is so polluted, can't move, no. Maybe the app could motivate them by messages like, look, air quality is good in the vicinity, in the park next to you. What about going for a walk right now? I would like that.
Okay, wow, okay. So one other for you. is it possible to apply similar methodologies to evaluate the impact on other health outcomes, morbidity, such cardiovascular outcomes?
Yes, yes, definitely. What we know from studies from the past is that people with respiratory diseases are vulnerable to heat and air pollution, and people with cardiovascular diseases as well. So if we would like to do an analysis similar to that for people with cardiovascular diseases, we would have to gather data, for example, how many myocardial infarctions are there in a certain area per day. Or if you would like to look at something less severe, you could also have a study and check patients' daily requirements of rescue medication to see when the disease worsens, and then combine this again with data on meteorological factors and air pollution in that locale.
Okay, wonderful. Thank you so much. And I think, excuse me, I think that's come to the end of the questioning. So just to share with the audience, I will follow up. We will follow up with today's recording and the also the slides as well as the details for Dr. Christina and Dr. Samya for their details. I know that my details will be on that as well. But just before the audience leaves, of course, I'd like to thank you both. That was, as I said, a wonderful presentation. But I'd like to take a few more moments of people's time to share with you the information about the 5th webinar and to remind you about the importance of Oasis Hub, which is a unique and very special global window to free and commercial environmental and catastrophe risk data, tools and services. So here at Oasis Hub, we now have almost 1,500 global industry professionals and academic members providing you, our members, with a community and infrastructure to explore, like we have in the webinar, discover and connect with other organizations and fellow professionals. So I feel it is important to highlight that when data and our services and tools are purchased via the hub, everything is reinvested back into the running of Oasis Hub, ensuring we continue to prosper on behalf of our community and continue to bring wonderful webinars as we have this morning. So membership is free. So if you haven't become a member as yet, please do so, and please do encourage your industry friends and colleagues to do the same. So next week, Tuesday the 12th, will be the 5th of the 6th series, or the 5th webinar of the 6th series. It starts at 11 a.m. on GMT and 12 noon Central European time. And it should last about 45 minutes. And next week's topic is Typhoon Climate Services. So it's got a couple of modules underneath it, a new catalogue and properties of typhoons, an innovation, a new TC event generator without tracks, and seasonal and climate change forecast. The panel, which we're very, very lucky to have, is Ralph Tournier, who is Professor of Atmospheric Physics at the Imperial College London here in the UK. So as I said, that's next Tuesday the 12th, 11 a.m. GMT and 12 noon Central European time. So thank you again both. You've been wonderful. And for our audience, I'd just like to wish you a good rest of the day, and we look forward to you for joining us for our next webinar. So again, Christina and Samya, thank you so much.
Thank you all for having us.
All right. Have a nice day. Take care. Bye-bye.
Goodbye.
Bye.